Well, this is the population that, for many years was ignored. We opened a study in the UK quite a long time ago, giving the patients low-dose Ara-C. And that produced a few remissions, 15%, and if they got a remission, they had, several months of remission. Azacitidine was introduced, and to my mind, it was always a wee bit controversial how much better than low-dose Ara-C it actually was. But anyway, people voted with their feet and adopted Azacitidine. The disadvantages that had to be given parenterally. More recently, oral azacitidines become available, but it was a wee bit difficult to do the study at the beginning, but that's helpful for older patients. And then you've got Venetoclax adding considerably to that benefit. And then you've got the other stuff which is new, which you've got a triplet. Now, sometimes when you add them together, they're getting more toxicity or myelosuppression than you would want. So I think the challenge at the moment, rather than doing randomized trials to see if they're better, is just to make sure the combination and the dose scheduling is correct. And there's a lot of activity going on with that. So that's that. And then the other thing that has been known about for a while is that if you have some mutations of IDH1, IDH2, they're now potential inhibitors, and if you use them in combination either with low-dose Ara-C or with azacitidine, that's pretty helpful. The real challenge now is how do you show in the young patients with these mutations, and I think there may be about 12% of patients will have these mutations, to get enough numbers to do a trial on them. And this is a challenge for the HOVON and collaborating groups, where they think they need 7,000 new patients before they find enough to do the randomized study of the addition of the IDH or IDH1, IDH2 inhibitors. But that study has been done. I may be mistaken, but I think the readout of that was stated to be 2033. So I may be wrong in that, but it may be a misprint in something I read. So there's a lot of challenges now for collaborative groups wanting to do clinical studies. They're difficult to do. The numbers are probably more difficult to get hold of. But you've still got to satisfy the regulators.